We're good.
All right. Go ahead and just leave it here for a second and then go to the next slide and I'll do the welcome from there. Welcome everyone to this afternoon's meeting. We appreciate everyone coming out. Today, the sports medicine staff would like to discuss the purchase of a piece of equipment that we think is going to be very important and vital to enhancing the quality of care we're able to provide to our patients in the sports medicine areas.
So as Lacey mentioned, today we're going to kind of introduce a new type of modality that we would like to incorporate into our clinical practice. So this specific modality is called photobiomodulation, or PBM. It's also known as laser, kind of in a more layman's term. It's not a newer type of modality, but it's a modality that in research has been shown to be pretty effective in multiple aspects. Brian, if you want to go ahead and click that next slide, kind of to get some general ideas of what it does. It affects, like I said, multiple portions of the body, specifically at the cellular and molecular level. It helps in producing or promoting tissue healing that can cause an influx of these type of cells that can help the tissue and the body heal in a faster manner. It's also been shown to decrease pain, which is kind of one of the primary reasons we kind of want to start incorporating this into our clinical practice.
So some of the benefits, like Riley mentioned, it does a great job of reducing pain, as multiple studies have found. Photobiomodulation, or laser, can also be used to help athletes in returning strength, be in rehabilitation when performing exercises. It'll facilitate strength gains and also promote recovery as well through its use. And the big issue now is concussions. It's actually been shown to help treat concussions and cognitive impairments as well, which is one of the only interventions that is possible to use. And it also helps with swelling, inflammation, spasm, pain, wounds, and et cetera, which you can see on this slide here.
So some of the potential benefits and side effects, I kind of put them side by side so you guys will be able to see them really easy. So the first main benefit that I want to talk to y'all about is the ergogenic effects, like what Brian was talking about. We can work on swelling, on pain, on edema, lymphatic drainage, all of these things with one tool. We can really target a lot of different injuries with this one tool. Contrary to that, there are very little harmful side effects known. With that being said, there's also little known about the side effects. Like the first presenter in this project talked about, Riley, he mentioned that this is not really a new modality, but it's something that's newer in research. So right now we don't know too much about the side effects, but the research that's out right now doesn't really say anything is harmful. Moving on from that, it's non-thermal and non-invasive. You don't have to make any cuts. You don't have to do anything like that. It's a lot safer than other therapeutic modalities that you may be seeing. One thing that you need to be careful of, which is number 2 on your right-hand side, is that you need to wear safety goggles. Yourself and the patient will need to wear them. This just reduces the risk of accidentally slipping and getting that laser into someone's eye or your own eye, or it refracting off maybe a metal tray or something. It just kind of gets rid of that liability. Because it's non-thermal and non-invasive, it also gets rid of the burn that you may see with some heat packs or ultrasound. It gets rid of maybe with dry needling, like some of you may know, that it may be really invasive and you have to go through extra steps to get that approval to do it. It is important to do the correct dosage and make sure that what you're doing is for the injury that you're trying to treat. So there are a lot of different ways that you can set up this laser treatment, and you need to make sure that you're not overdosing, because you can have inhibition, but sometimes the inhibition is actually what your main goal is. So you just need to make sure that you're well trained, you know what you're doing, and you're really looking at the laser that you want to buy and that you're giving the right dosage for your patient. And it's really less than 30 seconds are some of the treatments, anywhere between like 3, 5, 10 minutes and 30 seconds. So it's really beneficial.
So to purchase this equipment, we are obviously going to need to do some fundraising. The equipment that we are interested in purchasing is the MR4 Super Pulse Laser, which is by Multi Radiance. This machine does come at a cost, roughly $10,000. So the plan is for us to raise approximately 25% of the cost via various fundraising activities through the sports medicine department. And we'll also be applying for a research grant to help fund a portion of the cost, which is approximately $5,000. So that research grant would actually not only be, it would also help with our education and do some other things that are really important to our patients. So what we're here today to do is really ask if we are able to raise that 25%, if the board and the boosters would be willing to match that 25%. We know that we have lots of fundraising opportunities and abilities that can really get us to that $2,500 mark. And we're hoping that we can get you to help us promote quality patient care in our clinic with the use of this modality by helping us fund the price of this. So we appreciate your time today and thank you for coming.
Okay, I believe I stopped recording.